Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Hi mommies, I'm sure you're excited about your special day. I, Dr. Anita Chaudhary, will tell you how to create a perfect birth plan. The day you give birth is one of the most important ones of your life. Creating a birth plan ahead of time helps you make decisions about how you want your labor and delivery to be and let others know your wishes. So when the big day arrives, you can focus on what's most important, that is bringing your new baby into this world. What is a birth plan? A birth plan is an outline of your preferences during your labor and delivery. For example, your birth plan may include who you want to be with you during labor, whether you want pain medicines or you want the lights to be dimmed. You can even include anything you think that will make your labor and birth more comfortable. So keep in mind that no birth plan is perfect. A birth plan is not a set in stone because you cannot predict everything that may occur that day. You or your doctors may need to make changes to the plan once your labor begins. So try to stay flexible if something unexpected happens, which normally happens so many times. What should I include in a birth plan? Although it's tempting to include many details in a birth plan, try to keep it short so it's easy for everybody to understand and read. Here are some items your birth plan might cover. 1. The basics. List your name, your doctor's name and contact information, where you plan to give birth and who you are planning to have with you. In case of emergencies, this will become very handy. 2. The atmosphere. Think about what will help you feel most comfortable. Would you like the lights dimmer? Do you want your room as quiet as possible, or would you prefer some soft music? Would you like a support person to take photos or video of your labor or birth? 3. Labor preferences. Include any preferences you have for your labor. For example, do you want to walk around freely when you have your contractions? Do you want to use a birthing stool, a ball or a chair? Would you like to take a warm shower or a bath when you are in labor? 4. Pain medicines. Pain management during labor is an important consideration. You may not have a plan of an epidural, but you can always change your mind during labor. Or you may know that you definitely want to have an epidural, then you can go ahead. As you're defining your birth plan, ask your doctor about your options for pain relief as well, or any other questions that you have. These could include breathing and massage also. 5. Delivery preferences. There are many options to consider for your baby's birth. If you're planning a vaginal birth, would you prefer to have an episiotomy or you just want to go naturally? Do you want a mirror to see your baby's birth? I follow this in my labor room. Would you like your partner to cut the umbilical cord? Discuss that with your doctor. Do you want your baby placed on your abdomen right after delivery? If you need a C-section, who would you like to be with you in the delivery room? 6. Feeding and care in the hospital. Once your baby is born, you'll need to think about feeding and care. For example, you want to breastfeed right after delivery. So who will assist you in this process? Would you like your baby in the hospital room to be with you at all times, or would you prefer your baby stay in the nursery for some time? If your baby is a boy, would you like them circumcised at the hospital? Now, who should review your birth plan? Review your birth plan with your partner and anyone else who will be with you in your delivery. Your doctor or the hospital or the birth center may also know about your plan. Reviewing your birth plan ahead of time gives you time to help resolve any potential conflict. It is not necessary to have a birth plan, as all these preferences can be made while in the hospital. But it is certainly important to think about all the options and discuss them with your partner and the doctor to avoid the last minute anxiety. But remember one thing, just be with the flow. All these plans can always be kept aside when you trust your doctor, you trust yourself, and you trust the divine. So just let things happen and you will be a very happy, comfortable mother. Thank you and namaste.